I think our biggest obstacle we find is running into issues with patients not being ready when we go to get them for a therapy session. And it may be in our head that they're not ready because we haven't told anybody they should be ready. But so if someone's in bed when we get there, you know, as a PT, it's much easier than a speech therapist because, look, I can work on bed mobility right there, one of my goals, and transfers and balance. But I also think it's a great opportunity to meet with the nursing staff and, you know, give them some tips and pointers if I have some, or see how they cue a patient because they do spend more time with the patients than I do. You know, they're on an 8-hour shift with the same patient, so maybe they have something that I can learn from. And we can, you know, work together to have the patient reach their maximum function.
Some things that I may see them not doing is kind of just being more flexible. So, for example, if a patient is up all the time when they go to see them and the one day they're not up, they just go to the next person instead of maybe trying something at bedside or trying to train a staff member on their transfer, trying to work on something different instead of just bringing them down to the gym. I think a lot of times we have this idea that if you're a PT, you have to bring them down to the gym and you have to do this and walk and exercises out of the room. I think sometimes people who struggle when the person is not up or not in the ideal position, they'll go tell a nurse instead of maybe trying to brainstorm, like, what can I do with them on this day that they're not up and ready for me? What can I do to, instead of wasting 5 minutes going to tell the nurse, coming back, what can I do to make my time more efficient or manage my time better?